BDI Part 2 Partially Edentulous. McGarry and American College of Prosthodontics have introduced the BDI classification. We have three systems: completely edentulous, partially edentulous, and dentate patient. Today we'll talk about partially edentulous. The benefits of this system to improve professional communication, standardized criteria for outcomes, assessment and research, enhance diagnostic consistency, and simplified aid in the decision to refer a patient. In 2002, McGarry has established a BDI classification for partially edentulous. BDI classification for partially edentulous. We have a classification and diagnostic criteria. Class 1 ideal or minimally compromised, Class 2 moderately compromised, and Class 3 substantially compromised, and Class 4 severely compromised. Diagnostic criteria: location and extent of edentulous areas, abutment condition, occlusion, residual ridge, and condition creating gradual prognosis. This is related to Class 4 if we have severe or manifestation of systematic disease, maxillomandibular ischemia, and or ataxia, refractory patient. There is some guidelines we have to follow to use this worksheet. First, any single criteria of more complex class place the patient into the more complex classification. Consideration of future treatment procedure must not influence the diagnostic level. Hobless teeth should be considered in applying the classification. Initial pre-prosthetic treatment and or adjunctive therapy can change the initial classification level. If there is aesthetic concern or challenge, the classification is increased in complexity by one or more levels. In the presence of TMD symptoms, the classification is increased in complexity in one or more levels. In the situation where the patient present with edentulous maxilla opposing a partial edentulous mandible, which is combination syndrome or Kelly syndrome, each arch is diagnosed with the appropriate classification system. Starting with the location and extent of edentulous area. Type A, ideal or minimally compromised, any anterior maxillary edentulous area that do not exceed 2 incisors, any anterior mandibular edentulous area that do not exceed 4 incisors, and any posterior maxilla or mandible that do not exceed 2 premolars or 1 premolar and 1 molar. And all edentulous area must be located in single arch. While type B, moderately compromised, the edentulous area in both arches, plus there is missing maxilla or mandibular canine. Type C, substantially compromised, any posterior maxilla or mandible edentulous area greater than 3 teeth or 2 molars. Any edentulous area include anterior and posterior area of 3 or more teeth. Type D, severely compromised, any edentulous area or combination of edentulous areas require a high level of patient compliance. Criteria number 2, abutment condition. Type A, ideal or minimally compromised abutment condition. No pre-prosthetic therapy is needed. Type B, moderately compromised, in 1 or 2 sextants have insufficient tooth structure to retain or support intracoronal or extracoronal restorations, or required localized adjunctive therapy like perio, endo, or arthro procedure. Type C, substantially compromised, in 3 sextants there is insufficient tooth structure or required adjunctive therapy. Type D, severely compromised, in 4 or more sextants, plus the abutment have guarded prognosis. Number 3, occlusion. Type A, ideally or minimally compromised, no pre-prosthetic therapy is needed, and Class 1 motor and jaw relationship. Type B, moderately compromised, occlusion required localized adjunctive therapy like enameloplasty on premature occlusal contact, and as well Class 1 motor and jaw relationship. Type C, substantially compromised, entire occlusion must be re-established, but without any change in the occlusal vertical dimension, and Class 2 molar. Type D, severely compromised, entire occlusion must be re-established, including changing in occlusal vertical dimension, and Class 2 Div 2 and Class 3 molar. In summary, BDI classification for partially edentulous: Class 1 ideal or minimally compromised, in location and extent of edentulous area, which is confined to a single arch, abutment conditions, occlusal, and residual ridge condition. All four of the diagnostic criteria are favorable. Starting with the location and extent of edentulous single arch, include any anterior maxilla span not exceed 2 incisors, any anterior mandibular span not exceed 4 incisors, or any posterior span not exceed 2 premolar or 1 premolar and 1 molar. Abutment condition is ideal with no need for pre-prosthetic therapy. The occlusion is ideal with no need for pre-prosthetic therapy. Maxillomandibular relationship, class 1, and residual ridge morphology confirms to the class 1 complete edentulous description. Class 2 moderately compromised in location and extent of edentulous areas in both arches, abutment condition, and occlusal requiring localized adjunctive therapy and residual ridge condition. Number 1, the location and extent of edentulous in both arches as class 1 or any missing canines. Condition of the abutment in 1 or 2 sextants have insufficient tooth structure or require localized adjunctive therapy. Occlusal correction requires localized adjunctive therapy and maxillomandibular relationship class 1 molar. Residual ridge morphology class 2 as in completely edentulous description. Class 3 substantially compromised in all four criteria. The location and extent of edentulous area compromise the physiological support to the abutment, include any posterior maxilla or mandible edentulous area greater than 3 teeth or 2 molars, or anterior and posterior edentulous of 3 or more teeth. The condition of the abutment in 3 sextants have insufficient tooth structure or require localized adjunctive therapy. The abutment have a fair prognosis. Occlusion require re-establishment of the entire scheme without change in vertical dimension. Class 2 molar relationship and residual ridge class 3 as completely edentulous. Class 4 severely compromised with guarded prognosis. The location and extent of edentulous area compromise the physiological support of abutment teeth. To create a guarded prognosis, include acquired or congenitally maxillofacial defect. Abutment in 4 or more sextants have insufficient tooth structure or required extensive localized adjunctive therapy. Re-establishment of entire occlusal scheme, including change in vertical dimension, is necessary. Class 2 diff 2 or class 3 molar relationship, residual ridge morphology, class 4 as completely edentulous. Other characteristics include severe manifestation of local or systematic disease, include sequela from oncologic treatment, maxillomandibular dyskinesia or ataxia, and refractory patient.